Hey guys, welcome to Prasu'S Medledge. I hope you all are doing good and have watched my previous videos. If not, what are you waiting for? Go for those after the end of this video. Now without wasting any time further, let's get into today's topic. So today's topic is mitral regurgitation, which is a very important topic in medicine, oftenly asked in university exams. So mitral regurgitation is backflow of blood from left ventricle to left atrium due to improper mitral valve closure. Coming to the etiology of mitral regurgitation, it includes rheumatic heart disease, mitral valve prolapse, infective endocarditis, then acute myocardial infarction with rupture of a papillary muscle. And apart from these, there are many other causes, but these are the most important causes for mitral regurgitation. Now, coming to the pathophysiology of mitral regurgitation. So, in mitral regurgitation, part of the left ventricular blood regurgitates into the left atrium during the systole. As a result, there is reduction of volume of the blood which is ejected into aorta, and this leads to reduction in the cardiac output. On the other hand, because the blood which is to be pumped out into the aorta, it regurgitates back into left atrium. So left atrial volume increases and left atrial size increases. So the next time the volume of the blood which is returning from the left atrium to left ventricle, that will be increased. So this leads to left ventricular hypertrophy and dilatation, and finally leads to left ventricular failure, which in turn finally leads to right ventricular failure due to pulmonary hypertension. So left ventricular hypertrophy and dilatation, which leads to again reduction in the cardiac output, and it finally leads to right ventricular failure because of pulmonary hypertension. So these are the basic things which happen in the pathophysiology of mitral regurgitation. Now coming to the clinical features of mitral regurgitation, first let's discuss about the symptoms. So patient may remain asymptomatic, and if symptomatic, palpitation is the most common symptom. Then we will see symptoms of reduced cardiac output like fatigability and weakness. Then symptoms of left ventricular failure is also seen like orthopnea and paroxysmal nocturnal dyspnea. In case of acute MR, the symptoms are basically due to acute pulmonary edema. Okay, acute pulmonary edema is the cause for the symptoms in case of acute mitral regurgitation. Now coming to the signs, so pulse is usually high volume but may become collapsing in case of severe mitral regurgitation. This is because there is reduction in the cardiac output. As a result, there is collapsing pulse in case of severe mitral regurgitation. Now coming to the irregular rhythm, it is because of atrial fibrillation, which is a complication of mitral regurgitation. Next is with right ventricular failure, jugular venous pressure is elevated. Coming to the inspection and palpation findings, there will be rocking motion of the precordium. Okay, so this is an important statement, rocking motion of precordium with each cardiac cycle. This is due to combination of the retraction of the left ventricle and expansion of the left atrium during the systole, and apex beat is hyperdynamic in nature. In auscultation, the first heart sound is usually soft here. Now coming to the specific murmur of mitral regurgitation, it is a high pitched murmur and it is a blowing type of murmur, and usually it is pansystolic, that is present throughout the systole and best heard at the apex and commonly radiating to the axilla. So this is the description of the murmur of mitral regurgitation, which is a pansystolic murmur. Then coming to the investigations, so first we do electrocardiogram, which can detect left atrial enlargement, left ventricular dilatation and hypertrophy. Then we do chest radiography. It shows various abnormalities like cardiomegaly with left ventricular enlargement and giant left atrium. Okay, this is a very specific point, giant left atrium. Then we do Doppler echocardiogram, which can detect the degree of mitral regurgitation. And finally, there is barium swallow, which shows left atrial enlargement in the form of posterior displacement of esophagus. So posterior displacement of esophagus occurs because of left atrial enlargement. Then coming to the complications of mitral regurgitation, I have already mentioned atrial fibrillation is there, then left ventricular failure, which finally leads to right ventricular failure and pulmonary arterial hypertension. So pulmonary hypertension and right ventricular failure, these are the two late complications which are seen in case of mitral regurgitation. Now coming to the management of mitral regurgitation, it includes medical management and surgical management. So medical management includes restriction of the physical activity. For asymptomatic patients, we had to do follow-up with the help of echocardiography. For treatment of heart failure, we use, as usual, salt restriction and diuretics, and for treatment of AF we use digoxin, that is atrial fibrillation, we use digoxin, and anticoagulants are also given to reduce the risk of thromboembolism. Then surgical management, it is done if there is worsening of the symptoms, and the surgeries which can be done are reconstruction of the mitral valve apparatus by mitral valvuloplasty, or we can do mitral valve replacement with a prosthesis. So these are the two surgical options. So that's it guys, I hope you liked my video. If you like the video, please do like, share, subscribe and comment, and also press the bell icon so as to get notified whenever I upload a new video. And I have also made a video on mitral stenosis. You can click on the video shown on the left side and watch the video of mitral stenosis, or else you can click on the playlist shown on the right side of the screen to look for other mitral valve disorders.